school, do an eval, and then when you get the report, come back to me and I'd be happy to talk with you about the outcomes of it and we can work on it together. So the mom comes to the school psychologist and says, hey, my doctor told me that I needed to come to you to get this ADHD thing happening. And the school psychologist had to say, I'm sorry, I need to send you back to your doctor because that's a medical diagnosis and I'm not permitted to offer it, even though I'm a licensed psychologist, but because of working in that environment. So these are the kinds of things that happen when we get into this medical, clinical, school versus clinical sort of no man's land almost. But I actually think that these are relatively simple problems to solve. I think that we just haven't been thoughtful about ways in which we can do that. My sense is, when I was a practitioner, I would have loved to have been able to pick up the phone and call, whoever this child was seeing, because often, there are significant issues related to the release of information, how we're able to communicate, what information should be released, is it appropriate to release it? And then even things like, even in sort of the outpatient mental health world, there are issues related to some providers are not permitted to attend things like IEP meetings because they can't bill for it. So if they make the choice to go to an IEP meeting or to help out in the school or provide consultation in the school, they're essentially not able to pay for their own time. So, there are challenges around managed care and how we help to get some of these interagency collaborations paid for. But I would say that overall, I would like to see more communication. I think what ends up happening is there's confusion about ways in which that can happen, and I think even sometimes schools really hesitate to get too involved because there's concerns about, their openness to liability or whether or not they're making recommendations that then they have to manage the consequences for related to medications and things like that. So it's certainly a need, but I actually think that there are probably some easy ways we could think about how to unpack it, but it just doesn't always happen that way.
Yes, go ahead, Dr. Wolf.
Right. One of the things we haven't discussed is that a lot of the schools aren't quite ready and don't feel that they have an issue. So we developed a readiness to change measure for the schools so they can look at what's necessary before I actually do any of this programming. Because a lot of the programs that we've been discussing are great programs, but you have to have a receptive audience, someone who says, I really want that program. And most people think they don't need it. The status quo is a strong deterrent. So by at least letting them see, what do I need to do first before I consider involving my teachers in this or my staff in this? What's the first thing around, say, violence prevention or sexual abuse awareness and so forth? And it just helps them get on the right page. And like any readiness to change, you can educate them around how to move to the next level. So it just might make them a bit more receptive.
I totally agree, and I think that from an implementation science perspective, this is exactly what we're trying to grapple with, is that I think in the advent of school-wide positive behavior support, I think that there's a new focus on how to positively support ways in which children can work and play well with others and not be a pain in the classroom, which I think is great. I think the challenge is that with all of the effort that it has taken to try to really sort of try to get some of those models off the ground, some of the more comprehensive pieces around reasons why children might not be able to work and play well with others, or they may have learning issues, haven't necessarily happened. And it seems that there are communities that have more awareness than others about their needs related to that area. And I think that's why just more research is needed around how schools are sort of looking at their role and whether or not they even see it as a need. Because I think the last thing that we need is for us research types to be running around with new programs for people to implement without any regard for whether or not they have a sense of whether they need to or whether they can.
So I'm going to move to some of the questions that have come in from the audience via Slido. I want to just quickly answer one of the questions that came from many people, which was about the PowerPoint presentation. So just so you know, for presenters that give us permission, these will be uploaded to protectchildren.psu.edu if you'd like copies of these presentations. So once again, that's protectchildren.psu.edu. Oh, it's on the front of the flyer, the brochure for the conference. Yep. Okay, so another question that came in was about the role of parents. You both kind of briefly acknowledged parents. And, you know, for some of these universal programs that teachers are implementing, you know, in an ideal world, we would have parent support of those programs at home to kind of increase the chances of their uptake in terms of supporting children's self-regulation or behavior. And so one of the questions is, you know, when we're talking about children who have been maltreated or at risk for maltreatment, it's very likely that in their home environment, there are a lot of maybe concurrent risk factors, maybe certain issues with stress, mental health, chaos. And so the question is, how do teachers best support children's self-regulation when perhaps those children's parents are having trouble regulating in such a way that undermines teachers' efforts?
That actually is a very important question because it goes back to what I said earlier about, you know, one of the reasons why I wanted to work with teachers and looking at it from a systems perspective is, you know, if you just work with the parents as a prevention or intervention program, these kids are still coming into the classroom. And when you are dealing with the child welfare system and CPS involvement, the question of who is the parent, right, it comes to mind. If the child is still with their family of origin, it makes it a little bit clearer. But then that question does come up: how do you work with the kids if they do still live in a chaotic environment? And that's very hard because as teachers, you're not the family therapist to work with that. If they're in a foster care setting, the question is who then would be the parent if they move from home to home, or if the child is also working or living with a foster parent but getting regular visits from their family of origin, then who is the parent again, right? And that's why I think one of the things to keep in mind as educators is that sometimes you can think about the scope of practice or scope of area that you're working in, and what is it that you can do well within those boundaries. And as teachers, your role is very important, because having to be sometimes that stable adult figure for the child may be what the child needs. So you may not be able to influence any changes at the family of origin level, but at the school level, if you can provide that listening ear for the child, that sort of trustworthy adult for the child knows that you're consistently there and that you are helping them develop some of those core regulatory skills, then I think that alone can, and this has to be tested empirically, but that alone could be helpful for this child's development of self-regulation. That's one of the reasons why I like using the Bronfman-Brenner framework, because if you look at the proximal process, the classroom can fall within that microsystem in which stability over time can allow you to actually develop this quality student-child relationship that can help the child develop self-regulatory capacities. So if a child is dysregulating in your classroom, for example, as a teacher, you don't immediately punish the child, but help them work through some of these problems. If they're frustrated with the curriculum material, helping them problem solve. If they're frustrated with a peer, can you help them engage in more appropriate peer-to-peer problem-solving techniques? And so you as a teacher, given that quality of that teacher-student relationship, you're not becoming the surrogate parent, but well within that area that you're working in, I think you can be very impactful in terms of the change for the student or the child.
Can I add to that too? Yes. So I think from the other side as well, and I think that Carlo's points are really well taken. I think there's another sort of elephant in the room related to the relationship between families and schools. And the reality is that for many of the children that we're talking about, their parents did not have positive experiences at schools and do not necessarily believe that schools are safe places, because school wasn't necessarily safe for them. They had IEPs, they were in, and they had their own issues when they were growing up. So I think part of what we need to be thinking about in terms of parent engagement is how do we create a climate that feels safe for families, because I think sometimes parents feel like they're very put upon at the school level in terms of the amount of homework and the stacks of papers that come home and the fundraising and the selling wrapping paper or whatever. And as a self-proclaimed slacker mom who's like terrible at some of that stuff, and I think I'm a very high-functioning mom, I can sort of appreciate that for parents who have come from a more challenging school experience probably aren't going to look to us as people that can help them. And so I think one of the things we need to consider is the way in which we engage parents at all levels so that they might come to see us as a resource rather than as an authority that wields something over their life. So just another thing to think about.
Thank you. So another question that came up, Cristin, you've talked a little bit about special education, IEPs, and kind of the benefits of a case management approach. And one other question that arose was, what ought special education services look like for students who've experienced trauma? Will they qualify? And how do you differentiate between diagnosable conditions such as something like ADHD and children who've experienced a lot of trauma?
A really good question. I think the good news about the way the IDEA reads, at least my cursory understanding of it as a school psychologist, is that we don't really have to care what the DSM says to qualify kids for services in schools. Under the ED label, the emotionally and behaviorally disturbed label, if kids are having problems working and playing with others, if they're feeling sad, if they're experiencing symptoms, it sort of doesn't matter if they have a diagnosis of ADHD or ODD or whatever. So what's nice about it is that if we identify that a kid is demonstrating a need for specially designed instruction by way of their academically underachieving, or their behavior has become so challenging to manage within the school environment that it's likely that their achievement will slump over time, there are ways in which we can qualify kids and not necessarily have to look at this kind of medical model for how we do that. I would argue, though, that within a 3-tier model of support, there may be ways in which we can offer support to kids without the need for an IEP. And I think that's where some of this kind of school-based mental health, focusing on how to implement programs that help to support kids in learning how to manage their feelings and their behavior in a way that's appropriate and responsive for the context, I think are ways in which we can start to think about, how about we stop caring about whether the kid gets an IEP, and how about we start caring about ways in which we could either provide short-term support in the schools through either like a pre-referral service or through the MTSS model, or thinking about, can we be supportive of making connections between the child and family and outside services, and can we help to facilitate the work that they may need to do within the school environment, allowing the counselor to come to school to work with kids, allowing for a more sort of open communication between agencies and schools where it's appropriate and where parents give permission. So I think in terms of IEPs, the good news is if we take a prevention perspective, we might not have to care as much about the IEP, but if it's needed, I think there are ways in which under the law that we can make that happen and not have to say, well, it's a trauma thing, so that's not a disability. Well, if the kiddo's really having significant emotional problems as a result of that trauma and is in need, I think, at least from my perspective, I could make an argument for why an IEP might be indicated.
Excuse me, I really do need to share this because that's already been worked out. Under the Education Law Center's research and legal information, trauma is a medical condition. It can be screened for. Then the child's in entitled to accommodations under 504.
Right.
Districts are much more comfortable with that than the IEP path that costs
Yes.
millions of dollars.
Yeah.
And that actually is the best place for the child.
Right.
Because under accommodations, you can do all this other stuff that you know needs to be done.
Right. Thank you.
So Carla, there's a question for you, wondering if you can speak a little bit more as to the implications for school readiness for the children that you study, and talk about kind of good interventions specifically for early childhood school readiness for maltreated children.
I think as far as some of the results that you've seen in the studies that I presented, I think the self-regulatory processes have been linked to school readiness or lack of school readiness for some of these kids. When you think about the capacity to self-regulate in the classroom, the transition to formal schooling is as a developmental transition is challenging enough for these kids, moving in from preschool to then kindergarten, and then for a lot of these kids who are then also transitioning, if you think about that in conjunction with transitions within their homes, for example, if they're moving from foster home to foster home, then you have this sort of cumulative effects. And so for a lot of these kids who are, hopefully what you've learned about in the developmental impact of trauma is that these kids' top-down and bottom-up capacities are already diminished to begin with. And so as these kids then experience these developmental transitions, as well as some of these placement transitions, then you can see the cascading effect on functioning for these kids. So by the time they then get into the formal school setting, it may be harder for these kids to sit down, pay attention, wait for their turn. From an informational processing model, if the kids can't do that, then it's harder to encode some of the information that's being taught by the teachers. If there are conflicting information being attended to in the environment. So for example, if these kids have experienced physical abuse and they're more attuned or biased towards anger responses, and if, let's say, there's a peer next to them that's beginning to show some kind of disagreement and it's attributed as anger immediately, then they can label this accurately, but then that's what these kids might attune to if that's what they're experiencing in the home. And so there's, in some way, there's a function to that behavior in terms of protective factors, but in the school setting, it's a little bit harder. And so if they're attending to that peer, then it's harder to pay attention to the teacher. And so I think as far as interventions, as I mentioned earlier, the PATS program or curriculum offered within the Head Start Ready is one promising example that shows evidence of improving regulatory capacities as well as the top-down processes. Now, as I said, I think we still need a little bit more work of testing or evaluating this for the maltreated population, but it is a good start when you're talking about some of these students who are in the preschool in disadvantaged backgrounds. These kids have shown gains in socio-emotional behaviors, and so I think that as a target or a mechanism of change that we can shift, I think has some huge positive implications for these kids.
Ethnic minority youth, sexual minority youth, other minority groups tend to regularly experience trauma and complex trauma that may have kind of multiple layers. So another question is, how do we think about this complexity and these kind of multiple layers of trauma in terms of their influence on development, and how do we consider them in terms of programming and intervention?
I actually think that is a very excellent question, because oftentimes when I sit in on meetings or just sit in conferences, I see sometimes not as many ethnic minorities in the panels. And when we talk about a lot of traumatic events and the cross-contextual interactions between, for example, juvenile detention and foster youth, oftentimes there's a disproportionate minority. Sometimes African Americans are disproportionately represented, and I think it's important to understand what is normative developmental behavior and what is something that's attributed just because of someone's difference in skin color. And I think from a practice perspective, that has to be something that has to be addressed and brought up as a more covert issue, because just because someone might have darker skin and they're acting up, we don't want to attribute. So even our biases as teachers, practitioners, or researchers have to be addressed. That are we attributing certain behaviors because of someone's skin color? And so there has to be a check and balance within the teacher to understand, and this goes to being more empathic towards what's going on, and not placing the blame on the students, right? I mean, if the students are already living in some of the impoverished neighborhoods, we can't just dismiss that and say, well, that's where they're living, and that's not my problem. There's nothing I can do to change the neighborhood. You have to check your own biases as well, right? As a practitioner, as a teacher, as a researcher, in terms of, well, what can we do to understand what's going on for them, and the transaction between some of these risk factors and someone's ethnic minority status, and how can we shift our practice and our approach and our dialogue with them. I think that's really important. As researchers especially, I think we need to be a little bit more aware about race and ethnicity, because oftentimes what we end up doing is controlling for it. And I think controlling for it doesn't give us that rich understanding of how someone's development changed over time because of their skin color. That's more difficult to capture in our variable-oriented analyses, right? So I think taking that into consideration and really understanding not just race as a control variable, maybe sometimes as a moderating variable, or maybe implementing some more person-centered approaches that would allow us to understand, differential patterns and see if race is a predictor of those patterns. But then, again, as responsible researchers, we have to be careful in terms of how we interpret those, not as risk factors that predict certain problematic patterns, but that these may just be unique or specific to a particular group, and it may not necessarily be detrimental, that it might be more functional or more adaptive in nature. And I think overall, not just in terms of race, but also looking at kids who've experienced maltreatment, sometimes what's considered to be dysregulated responses aren't necessarily, it's an inconvenience for us working with them or working in the classroom, but sometimes if you think about it, these are functional behaviors for these kids. And so it's about learning what the function of the behavior is, why they're doing it, what are they trying to tell us, and replacing something that's disruptive in the classroom with something that's more appropriate, but still gets them what they need. And for some of these kids, for example, if they are experiencing physical abuse, some of it might be protective. And so we have to be careful about disarming some of those protective behaviors without replacing it with something that's a little bit more appropriate. I think bottom line is we have to see the humanity in everyone that we work with and see how we can translate that in the classroom, in the clinics, and as well as in the research.
I just want to thank our panel for a wonderful session on the developmental impact of trauma. And Dr. Jenny Knoll is going to come up and wrap up for us today.
All right, thank you all. So yeah, my great-grandmother said if you can't summarize it in 2 minutes, you're babbling. Or two sentences, sorry, you're babbling, so 2 sentences. So exciting day today, okay? We presented a lot of problems. We presented a lot of opportunities for schools to be involved in universal prevention, opportunities to engage parents, opportunities to overcome some barriers by doing some work with teachers, with administrators, to both develop these strategies and integrate prevention strategies within curriculum. We talked about what to expect when traumatized kids actually reach the classroom, and some of those challenges you're going to see cognitively, behaviorally, and even in terms of emotion regulation that can have some devastating long-term trends that we can see. We talked about how to unpack PTSD and other kinds of behavior problems that one might see in the classroom, and the challenges of implementation. And we heard a lot of those challenges, and we also heard some good news that there might even be some policies already in place that we can capitalize on to help mitigate some of these challenges, both in terms of garnering the right resources for prevention and also within the education system already as policies. So